Welcome back. KwaZulu-Natal is battling to contain outbreaks of foot and mouth disease across several major districts. The province is among the hardest hit and urgently requires widespread vaccination. For more than 200,000 cases have now been reported so far, with some still unaccounted for. Joining us now is Dr. Ntuthuko Mkhize, a senior lecturer in animal science in the School of Agriculture and Science at the University of KwaZulu-Natal. Dr. Mkhize, thank you so much for your time and for joining us this morning. What do you think are the key factors that make up foot and mouth disease a significant concern, particularly for livestock farmers and the broader agricultural sector?
Thank you very much for the opportunity. Good morning to your viewers. This disease is not just an animal health issue, but it's an economic disease, a social issue as well, because once you find just one case in an area, that area is locked down. You can't trade with other sections. So at the moment, the whole country, except for one province, is struggling with this disease. But our province in KZN is referred to as the epicenter of this outbreak. So farmers are really affected by it, and then we can't access the market that we're supposed to, and people are losing businesses. People are losing their livelihoods. Smallholder farmers cannot now survive on the animals that they are keeping as their safety, security measure. And the commercial farmers cannot also access the market. They have to close shops, and they have to retrench people, and a number of people are going to be affected. So this is a crisis disease by nature. I hope I've addressed your question.
No, you certainly have, and I think what's quite interesting is why KwaZulu-Natal is the epicenter of FMD.
That's a million-dollar question, because usually this disease usually affects the northern part of the province, like upper Utugela areas, because that is where our communities, livestock farmers, are farming very close to the areas that are referred to as your nature conservation areas, your wildlife conservation areas, game reserves, and that is where actually they find and they keep African buffaloes. These animals then are the ones that actually naturally known to harbor this the virus that actually causes this disease. This African buffalo, what happens is they have this disease, they carry it, but they don't get affected by it until they interact then now with our livestock, especially your cattle, sheep, goats, and sometimes also pigs. Once they interact with them, and then there's that nose-to-nose direct contact, and during the grazing in the areas where they are grazing, and that is when then they get this virus, and then they get sick, and they start showing signs. So, but now I think for some reasons, there might have been some lapses in terms of biosecurity, in terms of awareness campaigns. Maybe we were not, I don't know, they might not have been aware enough to contain it within those areas. Then it has ended up actually getting out of hand, because it's now no longer an issue of those areas, but now throughout the province we are struggling.
Yeah, and this then raises the question of vaccine and disease control measures. With the current shortages, especially when it comes to vaccines, what do you think the measures are that farmers can take, as well as authorities, in order to mitigate that spread of FMD?
Yeah, farmers have one thing, and that is actually to make sure that the biosecurity measures at farm level are up to scratch. There's no unchecked movement of animals in and out their farms, even individuals coming from other farms and visiting their farms or areas. This moving of animals legally from one area to the next, especially from areas that are struggling with this disease, is one of the things that we need to stop doing, because that is how we end up spreading the disease. But also, I think awareness, I've already said, surveillance as well. Our province has been doing that, but they need to also intensify their efforts in actually spot checking animals, visiting farms, and then checking if animals are having any disease, and then acting fast and quickly and earlier. So those are the things we can do. We stop the spread, we stop the movement of animals, we improve our biosecurity. When we see signs, we report as quickly as we can to the Department of Agriculture and the Animal Health Services. We also help the animals that have already been found to be affected, because then they limp, they drooling, they're having a lot of, you can see that they're going under a lot of pain. So you need to do whatever you can under being advised by the officials of the Department of Agriculture to alleviate that pain, because it's your responsibility as a farmer to make sure that your animals are free from pain. So therapeutic treatment is something that we need to do while hoping that this virus is going to get better, because animals usually take not more than 2 weeks, to get better if you treat the symptoms properly. We do get some deaths, but they usually would be from calves and animals that would be severely affected. So what you do is with what is within your control. But again, the state government needs to come close and assist with enforcing some of the measures that need to so that we need to be enforced, so that at least we recover our FMD free status quicker than later, while people are still alive and they're not trapped in that poverty of not moving your animals and not being able to market your animals and your products.
Most certainly, Dr. Mkhize, and I think you raise a very important point there with regards to government interventions, but maybe just explain to us what the current status quo is, especially in how the stakeholder, being the farmers, are working together with government in ensuring that this, which looks like is becoming a crisis, doesn't get into a situation that's uncontrollable.
That's true. It is a crisis. If you look at, like, maybe I should have mentioned earlier on that already our government, by 2022, they'd already vaccinated almost 900,000 animals in the province. But looking at the 900,000 animals vis-a-vis the 4 million animals that we are having here in the province in terms of cattle, you can see that actually that effort, as much as it is good, well-intentioned, it is not sufficient. And I doubt if we have capacity to do that quicker if we do not work together with all the stakeholders involved, including the farmers themselves, who are the most affected people. They should be the people who are willing to help so that they can get back to business and not close their shops.
So, I mean, you mentioned that, 900 cattle was vaccinated back in 2022 as opposed to 4 million. How often do these vaccinations take place, especially when we're talking about a country that has shortages when it comes to vaccinations of FMD? And how would it help us to be able to produce our own vaccines?
In all honesty, our observation is that our country has been very responsive when it comes to dealing with this matter. One of the reasons is that we have the supply of vaccine has been disturbed by the fact that the organization like the ARC, Agricultural Research Council, was supposed to produce it, had to stop at some point while they were still reviving their capacity to produce it, and that actually left us at a risk of poor protection. So I'm saying we have not been doing enough in terms of safeguarding ourselves and our industry, in terms of making sure that we do it as often as possible as we can. But we have been very responsive and very reactive, and that is seeming now proving us wrong. We should now be proactive and make sure that when we get out of the situation, we never have to deal with it again. And when I looked at the strategy that the department proposed yesterday, their 10-year national strategy, and the fact that ERC now is going to help with the local vaccine production, and also the support that we are getting from the other countries that they talked about, 3 countries, I feel like at least we might be able to turn the corner. But once we have turned it, let us not look back. Let us also improve our biosecurity measures. Let us also improve our traceability issues in terms of animal identification, and making sure that we are able to trace the animal from farm all the way to fork, and make sure that at least we don't even rely on this system that the FMD management is relying on now, which is very much geographically based. You're zoning an area just because 1 or 2 animals have been found to be positive. But imagine a situation where we could now focus on the product that gets produced from the farm. And if with that product could be proven that it is FMD free, then we will not have this problem of locking the whole country just because a few areas have tested positive for a particular disease.
Lastly, Doc, I mean, you speak about turning the corner as well as that 10-year national strategy. You mentioned earlier the impact in terms of the economic and the social issues that come with issues such as FMD. What do you think would be the long-term implications of such an outbreak on food security and the livelihoods of people, not only in regions like KZN, but South Africa as a whole?
The consequences are far-reaching and they are dire. Looking at, like I'm saying, there are people actually who are, even when we solve this problem is not going to be solved within a few months. It's going to take a long time to resolve. By that time, a lot of people will have lost jobs, will have lost businesses. A lot of people will have actually been trapped in poverty, and they already were a very poverty-stricken country. So this is only deepening that social ill. And so actually, what I'm saying is the long-term implications are very serious, because it means we are going to now to have to cater for more people in terms of social support, in terms of the social grants and all that, because people now will not have means to produce their own income and stuff. Because a lot of people are going to lose jobs, and like I said, we are also as a country going to lose. We already have lost the status of being a FMD-free country. And what is happening is we are losing reputation in the industry, livestock industry in South Africa. The red meat our producing capacity of red meat is also getting to be undermined by this, and we might find ourselves not being able to export as much as we were after this outbreak. So our reputation is also at stake if we already have not lost it.
That certainly has dire consequences. Dr. Mkhize, thank you so much for your time and just outlining what the possible solutions could be for South Africa, as well as the province of KZN that is the epicenter of foot and mouth disease. That's Ntuthuko Mkhize, who's a senior lecturer in animal science in the School of Agriculture and Science at the University of KwaZulu-Natal.